within our communities. As kids return to learning in person, my top priority remains the health and the safety of Ontario students, school staff, and their families. On this point, I've been uncompromising. Throughout the pandemic, schools have remained safe and kids have continued to learn. This is not by accident, but rather is a reflection of the comprehensive investments and the measures we have put in place following the expert advice of the Chief Medical Officer of Health. Furthermore, on the advice of medical leaders and with our commitment to continually add layers of prevention onto our schools, we have strengthened measures for when kids return, including enhanced screening when students and staff walk through their school doors in the morning, mandatory masking and better quality masks for students in grades 1 to 3, including when outdoors if physical distancing cannot be maintained, and province-wide targeted asymptomatic testing using both rapid and lab process tests based on the specific circumstance and as decided by the local public health unit. When we first launched targeted asymptomatic testing for students, staff, and their households, we started in parts of the province which at the time had among the highest numbers of active COVID cases in Toronto, Peel, Ottawa, and York Region. Under this initiative, 63 schools participated and approximately 9,000 tests were completed with approximately 200 new cases identified. Through these tests, we found that under 2% of all student cases came back positive, and the majority of positive cases were found in those outside of the school. Today, I'm announcing that we are expanding this testing approach to other areas of the province for schools and childcare settings experiencing either outbreaks or high case counts, or if they happen to be within high priority communities. The first phase of this testing has made it easier to track and prevent the spread of COVID-19 within our schools by helping to identify cases early, to inform public health decisions, and ultimately to manage any outbreaks. The Ministry of Education, along with our partners in the Ministry of Health and Ontario Health, are continuing to work with school boards and health partners to support this testing where it is needed province-wide. Access to robust asymptomatic testing has been offered to each and every public health unit that is welcoming students back to class, and we will continue making this offer as we bring even more students back. In addition to expanding testing and other safety protocols, today we are allocating an additional $381 million in targeted funding to go even further in protecting the health and safety of our students. This funding will invest $50 million for improving air quality and ventilation within our schools, such as additional portable HEPA filters and upgrades to provide immediate improvements to ventilation for our students and staff. $65 million additional dollars for health and safety costs, such as board-funded or transportation-related PPE or staffing. $62 million for summer learning supports, including core programming and upgrading courses, special education and mental health programming, reading and math programs, STEM summer programming, and supports for underserviced students in our province. We're also announcing an additional $10 million to support mental health of all students and the support of the implementation of the new School Mental Health Ontario Action Kit, funded and additional funding for Kids Help Phone. We're providing $60 million for online learning, including elementary remote learning course packs, $80 million for student devices such as more laptops and tablets, and much more. And with this additional funding, Ontario schools are being provided with more than $1.6 billion in critical supports to protect the health and safety of our students, of our staff, and of all Ontario families. Now, I've spoken to you about how many schools are experiencing short-term staffing issues because of the COVID-19 pandemic. Now, despite what some will say, there are not tens of thousands of teachers available to enter our schools and educate our students. To ensure we keep distancing in our classroom, we need to be creative. To provide immediate access to potentially thousands of young, capable, innovative educators, we have worked with the Ontario College of Teachers over the past weeks to introduce a new temporary certificate for eligible teacher candidates that will allow school boards to employ eligible teacher candidates when there are no occasional teachers available from their current lists. This is an important initiative that will benefit students in schools across the province and provide valuable work experience for the future leaders in our education system. Crucially, it means that we will meet our staffing needs and will be able to keep our schools open. At the heart of our public education system is a shared responsibility to ensure the success of all students. That's why our government remains firmly committed and focused on providing school boards, students, and families with the resources they need to stop the spread of COVID-19. As Minister will do, and our government will do everything within our power to ensure that schools continue to be safe, healthy spaces for our students, teachers, and all staff. Thank you. I'll take some questions.
We'll go to the phone lines for questions. Just a reminder, it's one question and one follow-up. First question.
From Haley Cooper at Newstalk 1010. Please go ahead.
Thank you so much. Minister, we have to ask exactly why you're holding this news conference today. With all due respect, there doesn't seem to be anything really new here for parents in terms of any kind of clarity about when their children will return to classrooms. So are students in the hot zones returning to in-class learning on February 10th, yes or no?
Well, there's 280,000 more students returning to class today. We do believe it's important parents understand the new protocols and measures put in place, more details around our asymptomatic testing program, upwards of 25,000 scalable tests per week that can be deployed in addition to the antigen testing that's being layered in, especially as we deal with the new variant. We've introduced new protocols and requirements for staffing and for student screening before they enter our schools, a mandate of masking now down to grade 1, a better quality mask for those young children, and additional investments. I mean, we're announcing $381 million that we've allocated now for school boards to hire more staff, improve airflow, more PPE, and additional supports for learning. In the context of the way forward, I think we've been consistent that we want to get all students in all regions of our province back to school. That is a consensus position of our government with the medical community. We heard clearly from the Council of Medical Officers of Health, and we agree with the premise. It is important for children to be within schools for their mental health and their development. And we are looking forward to advice from the Chief Medical Officer of Health and medical community about how we can get all students back. We know parents want certainty on the matter, and we hope we can provide that in the coming days based on risk assessment and, more importantly, based on the new protocols, the stronger, stricter protocols put in place to make sure that when we reopen, all kids can be safe in this province.
Okay. So if I'm interpreting your answer correctly, an announcement will be coming in the coming days on whether students in the hot zones will be returning to in-class learning on February 10th. If that's incorrect, then you can correct me in your answer to my next question. But is there any consideration being given to canceling the March break to try and make up time that's been lost?
So the short answer is we hope to provide that clarity to parents based on the advice of the Chief Medical Officer of Health. That analysis is being done in real time. And the position of the government is we want to get this right. We want to keep kids in class to stay in schools, not have to open and close, which is why we've taken a more cautious approach of opening in those public health units with lower rates of community transmission to get these kids back, to build confidence, and to make sure that those measures are in place. With respect to March break, we have sought the expert advice of the Chief Medical Officer of Health, and we will be providing parents with sufficient notice on that decision. But I will turn it over to Dr. Williams to provide additional context.
Thank you. On the question of what we're doing on February the 10th, we're looking at the data as we said we would be doing. Our major concern was that as we were approaching lifting or dealing with the stay-at-home order, we were dealing with back at that time very high community transmission. Many health units were well over 200 per 100,000, much higher than we were when we came into the festive holiday season break. At that time, already we're seeing rising number of cases in coming to our schools and more having to close courts and investigate that further. So we had waited to see if the Boxing Day lockdown would have greater effect, and during the holidays it didn't. But now over the last number of weeks, we are seeing the numbers come down very quickly. We're looking at even our top health unit as now just about over 150 per 100,000. That's extensively down from where it was. In the next few days, we shall see that again. So there's two things we want to do. One, are the community transmission rates coming down and going in the right direction? The answer is yes. The next thing is that do we have enough systems in place that we didn't have in the fall for even further testing And Mr. Lecce has alluded to that with the so-called targeted testing that's used in various settings to go after and ensure that we have that measure. Because some say, do you really know what's in the schools? We are confident in the fall we did. And we're saying now with this in place, we are going to be confident to say, what is the percent positivity in the schools, yes or no? And it was low in the fall. And we think it's going to be low now. The other method is to make sure that parents who have concerns about their child, will they be able to approach public health and have them tested either if they have very mild symptoms, because as you know, before we went in, some health units under the medical officer of health, such as in Peel and in Toronto, had moved the bar for sensitivity down to one mild symptom, and they asked them to stay home or get tested. And we had some difficulties making sure that testing was available in a timely way, in an effective way, and efficient, so parents had a quick answer. We're putting that in place now so that we can do it through our rapid antigen testing, so that parents who want to ascertain that, even a child who has maybe very mild or, uncertain symptoms, they may have concerns they want to have tested. How can they do it without long lineups, long waiting to get a phone call, long time to get a turnaround time for the test? We don't want that to occur. The other factor we're looking at right now is what is the history of our variants, and this is expanding. We just developed the rapid PCR test that we've been using with PHOL is the leader of this in Canada, North America, and we're starting to roll that out to do all our positive tests because parents want to know if my child or someone is positive, do you know if there's variants in the school, yes or no? And we want to be able to answer that in a very timely fashion. So all these things have to be put in place. The proper testing, the methodology, the proper people to do it, and the backup systems that will give answers back to parents, teachers, educators, so they can be assured what is in the school at this time. And we want to be able to say, just like in the fall, it's safe, it's a good place to go to school, and we are watching, we're not ignoring it, and we're being careful. So we're hopeful that we're looking for that February 10th date with all things being in place.
We'll go to the next question.
From Caroline Alfonso at the Globe and Mail. Please go ahead.
Thank you. Hello, Minister, Dr. Williams. Would you please share with me the specific metrics that you're using to reopen schools when you say you're looking for rates to go down? Down to what?
Dr. Williams, I'll turn to you.
So not an exact number per se. We would like them all down ideally quite low, but we know, one, that from our feedback from our public health measures table and from our council medical officers of health and talking with medical officers of health, that if the rates are still showing community transmission up in the levels of, let's say, under 200, they're now 100 to 150 in that range there, can they still open? I say yes, with proper checks and balances. What the ministers announced and what we're saying from a rapid antigen testing protocol for health units to deliver an offer so that they can quickly assess not only the safety of the child, maybe siblings and or family if needed to be, in a way that is convenient, safe, not the nasopharyngeal swab, but the lower nasal swab, so much more amenable to, say, repeat testing for young children if necessary, because some will find it difficult to get them to cooperate many times on the nasopharyngeal swab. So all these things in place saying, can we open up with some ongoing community transmission? Because one thing we're doing a lot more now is we're doing a lot more testing. Over the holidays, we've gone up many times to mid-75,000 in one day, and we can go even higher. That's the difference. We know what's going on in the communities, but how do we make sure that that separation is occurring between the community and the school? Because we don't want them mixed, and we want to keep the cases out of the school. As we did in the fall, we want to do it again now, because once we open, we want to stay open.
Follow up?
That doesn't really answer my question because I'm confused. London and Ottawa reopened its schools today, but Brant County, which has lower rates and a lower positivity rate, still remains closed. So what metrics are you using to determine how to reopen schools?
Thank you. We use a number of metrics, and we also consult with the medical officers of health. We had consulted with both a number of them, And in the case of Brant, we discussed it with the medical officer of health, who was not comfortable at this time to open, and we respected that opinion of what was going on in their community. Ottawa, with Dr. Etches, was more than eager, and with their systems in place, they said they could offer it and undertake that at this time. So there's our metrics, there is the trends and directions, as well as the systems that are there for the backup, and most importantly, the local medical officer of health. How do they feel about where they are with what's going on in their community, with the movements in and out of their respective health units? How do they feel that that would make it safe yet to open or not in that context? So in that case, we did have that consultation, and they said they would prefer to wait and to open with the others in due process.
Next question.
From Chris Rushery at the Toronto Star. Please go ahead.
Yes, thank you. And just getting back to the metrics issue, what would you like to see in the hotspots, Toronto, Peel, York, Hamilton, Windsor? What would you like to see there specifically before schools can reopen on February 10th or later?
We want to see, with the medical officer of health, their plans to say, opening now on the 10th, what do you have all in place? Are you satisfied that you feel is, one, the school should open, and that you have the backup systems and things in place to assess any situation as assertively and as quickly as possible, so that we will not have, as we did before, as we didn't have before, we did not have transmission in the schools documented. We don't want transmission in the schools, and we want to keep that out. So we're asking them all now to put those plans in place, and all the preparatory work. We've done our part. We've changed the methodology, got approval from the company to make it amenable for lower nasopharyngeal. That took time to get that in place. We changed the regulations so it doesn't have to be delivered by a regulated healthcare professional, to allow a larger cadre of people to be involved in that. We put our documentation systems in place. So there's a number of tools that need to be in there, accompanied with what the Ministry of Education has put in place, that will give the parents, because a number of parents are wondering, how are you going to persuade us that it is safe? We want to make sure you're informed and you know what's going on in your school and in your area, and you know it's safe for your child to go to school and for your family to be involved in that. So we want to reassure them, and we're asking our medical officer of health, get that in place. Are you ready for, say, for the 10th? If you're all ready, including the hot spots, then we're ready.
Follow up.
What kind of supports are you going to be giving boards and public health units for the expanded testing? Are you going to be giving them tests, lab space, staff, and will you be giving them any direction on whereabouts and when they should be doing this testing?
The ministry has worked to procure capacity of upwards on a scalable level of 25,000 PCR tests, an additional 25,000 antigen tests that can be deployed in any public health unit as decided by the medical officer of health. We are deferring to the medical expertise of the local medical officer of health. They know their communities, and they will deploy the testing, either or, within schools on a need basis. And that's why that capacity was built up. It's why we took action to ensure on day one when we reopened schools in this province, we had that PCR capacity, which will be very helpful in expanding the targeted asymptomatic program in all regions of the province. An additional layer, as noted by the Chief Medical Officer of Health, is the antigen testing. And part with these new variants, we want to make sure parents have access to immediate and efficient and fairly seamless testing. And as the Chief Medical Officer of Health said, for a child that has any symptom, they can use this rapid antigen test. Roughly an hour later, they'll be provided with a result. And that type of speed is a strength. We want to really reassure parents that we have that type of testing capacity both on a symptomatic basis and on an asymptomatic basis to make sure the schools remain safe. In addition, part of the announcement today is providing more funding for better PPE, for more PPE, for additional staffing and health and safety investments, particularly for airflow. When you look at it as a comprehensive plan, or you look at it on its totality, the plan has helped us. This plan, fully funded and endorsed by the Chief Medical Officer of Health, that allowed us in the fall to get us through with success. As Kids has noted, at a time of lower community transmission, the plan worked quite well. We aim to strengthen it because part of the responsibility for us, both in government and in the medical community, is to make sure that we're responding to a changing risk profile. And for parents out there, you know, they see what's taking place within our communities. They want to make sure that these schools are safe. And we are not going to be static in our thinking. We're going to continuously add more investments, more measures, and stricter protocols in place to make sure that all staff and all students can remain safe in the province.
Next question.
From Randy Rath at CHCH TV. Please go ahead.
Hello. I'm wondering, when you talk about discouraging kids from congregating on their way in and out of school, realistically, how do you achieve that? Is somebody going to enforce it? What are you going to do to make that happen?
Well, first off, a change taking place within our playgrounds. For many people who've driven near a school, they'll often remark to me, we see the kids out, they're playing, that is good, getting fresh air, but they're not keeping distance, and it's tough, I think, on this teaching staff to enforce it with respect to the playground. And so we've asked and we've provided the authority and now directed them when outside, when distancing cannot be achieved, they've got to have a mask on. In addition to that, what we're signaling, I think, both to staff and likewise to parents, is the necessity, especially given the heightened level of community transmission we've seen over the past period of time, that parents and students do not in any way, or parents do not permit their children in any way to congregate after class or before class. A much stricter enforcement of that principle. We appreciate this is going to require the partnership of everyday parents, of children, of staff. All of us have to be in this together, as we've seen that collaboration, that sort of unity of spirit in the fall that really got us to the present, keeping schools open and safe. We are really leaning into that, and we're providing a much more stricter direction, if you will, signaling that any type of congregation after school on the weekends, it has to be limited to make sure that we are not in any way compounding or exacerbating the potential spread of this disease, especially given these new variants. We've got to be absolutely vigilant and really enforce that principle at home, on the playground, as we are now doing, and likewise within our schools.
Follow up?
And also, when you're talking about masking kids in grade 1, 2, 3, are you going to supply masks for them? Where can you get masks that properly fit a small child's face?
We've already procured 3.5 million masks for children's age between grades 1 to 3. According to the Public Health Agency of Canada, a 3-ply mask, a better quality mask has been directed. We have procured them and provided them to school boards as they reopen, given the new mandate of masking down to grade 1. So we have done that. They do exist. We have procured them with our partners in the Ministry of Government Consumer Services, and school boards have them. For those that are open, they would have them today.
Next question.
From Cynthia Mulligan at City News. Please go ahead.
Hi, Minister. You've been telling us that the transmission rate among schools is very low, and I believe the number one that you've used is 8,000 positive cases out of 2 million, which does seem very low. However, in the same short time frame of 3 months, from mid-September to mid-December, there were almost 32,000 positive cases of school-aged children. How do you know that there weren't some amongst those 32,000 that actually didn't get it in schools? And do you think that is actually a possibility, that the number is actually much higher of school transmission?
Yeah, what I've said is the position is echoed by the Chief Medical Officer of Health. My position is informed by the medical community, who believes in the fall schools were both safe places for children and for staff. And when we did 9,000 tests within the latter part of the year, sort of mid to late November to December, which, to be fair, in that the last semester, in the first semester, if you will, that was at the highest rate of transmission we were experiencing within our schools and within our communities. Of the 9,000 tests, students had a positivity rate of roughly 1.8%. There's a 1% positivity rate amongst those 9,000 tests for staff, and a higher level, I believe around 4.5% for the parents, because we permitted the parents, the family, if you will, the staff, and the students. I think what that indicated, the first phase, is that on the asymptomatic level, that spread just was not there. And we were, the public health units across the province weren't, targeting the lower risk neighborhoods. They were really going into some of the highest rates of positivity to really understand, can we identify any cases and better understand the rate of spread within schools. That helped inform the position that schools have remained safe and not been places of transmission, largely brought in from the community. But this is a position that's been provided by the Chief Medical Officer of Health and one that we feel confident with the additional testing, both PCR for asymptomatic and the antigen testing, rapid 1 hour testing for symptomatic parents. We think this will really help us maintain that reality and keep schools safe. But I will permit to the Chief Medical Officer of Health maybe to build on that principle.
Well, thank you. And throughout the number you're quoting there is a number in that age group. Some were not tested through school system, were tested because of family contacts and outbreaks in households. But at the same time, when we found cases, the health units in the school, someone coming to the school and were tested positive, they would sometimes isolate a cohort and sometimes test all the students in the cohort. Or sometimes there are a few schools that they closed for a number of days and tested everybody. In that, they didn't find very many positive cases related to those cases. They tend to find that most were coming to the school positive rather than having obtained it in the school. And where there was any suspicion that there might have been ongoing transmission in the school or in the cohort, they would close that cohort or school and then ask for testing on the whole group. And sometimes that took some time to put together. But now with what Minister Lecce is offering, that's going to be readily, quickly available if a health unit is concerned that there may be ongoing spread, even a possibility of it. Test the whole school and see what you find in there. Of course, it's voluntary, and you want to ascertain that. But you want to be able to say, as in the past, we found very few outside of the cases that showed up in the school positive at that time. And you may get 2 or 3 in the same time period coming that are positive but have no link with each other. The assumption is maybe they got in the school, even though there's no class intermixing. When you test them and do the background testing, you usually found that there was some more activity in the households back in their respective areas and their families. So we did that. We're going to do that again. And we did a lot of testing, as you can see. We didn't do it without, because some places don't do as much robust testing as Ontario does. We do it because we were looking for it. We know it's there. We know it's going to happen. But we want to circumvent that infected patient or client and child getting into the school for a period of time. And we did that in the fall. We're going to do it again now.
Follow-up?
Okay, thank you. Minister, perhaps you could answer this next question first. There does seem to be a definite shift in how you are thinking, though. I have been asking multiple times since September why we wouldn't be proactive and do asymptomatic testing in schools so that you would have a proper baseline and know for sure what's going on. So there does seem to be a shift, and can you tell me what is behind that shift?
Well, every step of the way, Cynthia, we followed the advice of the medical community, the Chief Medical Officer of Health, guiding us on when and where we should be deploying those additional layers of prevention. We had the phase 1 of the asymptomatic testing in the hot spots, often in communities with very high rates of positivity, and the results, roughly 1.8% for students, 1% for staff, I think demonstrate that schools have been relatively safe spaces. Obviously, community transmission is rising and has risen sort of systematically through the fall and into the winter. We now have new variants that have entered our country. We have to continue to demonstrate to parents and to our frontline staff an absolute commitment to keep them safe and do whatever it takes to ensure we achieve that, which is the basis for we've expanded the asymptomatic testing. It's why we're adding another layer with the antigen testing, rapid testing for parents to make that process seamless and easier in their communities. So, I think for us, the default is following the medical advice. That is how we achieved a plan in this province that allowed kids, 1.5 million children, to go to school safely every day in the fall. And we're going to continue to lean into and follow the expert medical advice of the Chief Medical Officer of Health, of leading pediatric institutions who we have sought perspective and counsel from, including Sick Kids and other pediatric hospitals in the province, to guide us, to make sure that every parent knows that when their kids go back, should they go back into schools, if they opted for the in-school learning experience, that those kids are going to be safe, and that we have all the requisite investments, the staffing, and the measures in place to ensure that their kids could be safe each and every day.
Next question.
From Mike Crawley at CBC News. Please go ahead.
Minister Lecce, your government talks about how you've allocated almost $1.3 billion towards safe school reopening. But if you factor in that $381 million of that came from the federal government in the fall, and almost $500 million of that is simply allowing the school boards to tap into their own reserves, that leaves basically $400 million in actual funding from the provincial government. So how would you respond to criticism that says, that works out to basically $200 per kid, and that is an inadequate amount of money for the provincial government, which has responsibility towards education, to put towards safe reopening of schools?
Mike, in June, before when schools were closed, we announced the Grant for Student Needs. That's the vehicle funding for school boards. We increased it to the highest levels ever recorded in provincial history. The per pupil amount, the amount of money we provide per student, is up. The investments for school boards is up. Special education funding is up. In addition to the overall investments we're making in some of the basics like reading as well as mathematics, we have increased the investments well before September. We've added additional monies and investments every step of the way. We've leveraged our federal partners and school board reserves to unlock every single dollar available to ensure the province today, at a $1.6 billion investment, leads Canada with the strongest investment, but even beyond the dollars, because the dollars can be abstract for some people. What that has led to, folks, is 20,000 more HEPA filters and 20,000 odd HEPA filtration units, portable HEPA units in portables and in other spaces within our schools to improve air quality. It has led to over 600 new public health nurses who provided thousands of contacts directly and provided supports to parents and to children throughout the past several months. It's allowed us to hire over 3,400 new teachers, with a plan on track to hire another 800 in short order, and over 1,300 custodians, with another 400 targeted for hiring as well in the winter and the spring. That has enabled Ontario to have safe schools. It's positioned us uniquely in the province to offer an online learning option as well as an in-class learning option, which is a strength for parents, especially now during this pandemic. And we're proud of that investment. But in addition to the dollars, it's the measures. It's the fact that we have a capacity to deploy asymptomatic testing on a targeted basis province-wide. It's the ability to ensure PPEs are readily available and a better quality PPE is available based on the emerging evidence and advice, including from the Public Health Agency of Canada. So we are going to continue to be there for parents, for students, for our educators and our administrators, every one of which is working very hard. And we will continue to make sure that the protocols and the investments are there to keep these schools safe right to June.
Follow-up?
Wanted to ask further clarification about the asymptomatic testing. We were told in the technical briefing that the target is to have 50,000 tests done per week. Can you tell me when you expect to be able to reach that level, whether it's a date or a number of weeks after everyone is actually back in class? And what's the total allocation of money specifically to testing at the schools? Because we were also told in the technical briefing that the money that the province has written down as being allocated towards testing, $23.6 million, actually a big chunk of that was towards testing of school-aged children at the assessment centers. So clarify how much money is being spent towards the asymptomatic testing programs at schools, and as well a target date for when you're going to hit 50,000 tests per week.
So on the testing, we have capacity of up to 50,000 tests per week. It's scalable. So as public health units come online, that capacity will be provided to them. Once all PHUs, all public health units, all school boards are back, which is clearly the intention of the government, get them back as soon as we can, as soon as it is safe. We will have capacity for upwards of 50,000 tests, a blend of the PCR and the antigen tests. So all school boards that are open today, for example, or were open last week, for example, had access to the PCR testing with the local public health. We've just procured additional capacity to make sure that there's people available to do those types of swabs and make it more available within communities across the province. I think that really was a priority for us over the winter period to make sure that that capacity exists.
This will be the last question.
From Ian McLennan at Barrie 360. Please go ahead.
Hello, Minister.
Before you start, if I may, just before you start, if I may, Mike also asked about the monies associated. We allocated roughly, I believe, $23 million in the summer for testing, which would have covered the asymptomatic testing. Some of the unused dollars there will be applied for this testing capacity expansion, and we're allocating additional monies to do that. So the point is we are working in partnership with Ontario Health to make sure we've got the actual testing kit. We have procured the people to do it, to be deployed according to the regulation, to get into our schools and to other community centers to do it. So the monies are set aside. We have more than enough than we will need to get us through the school year, and that's partly based on the original investment in the summer of 23-odd million for testing in the province for schools. Pardon me.
Hello, Minister. Thank you for taking my question. And Dr. Williams, we've heard from several teachers, Minister, who are special needs, who are in the classroom, who are in the schools, and there have been COVID-19 cases reported, but they're not being reported by the schools or by the school boards to those teaching staff, to the principals, etc. Prior to the schools being closed for the holiday season, school boards in Simcoe County updated the numbers on their websites. That's not happening anymore, and these teachers are asking why. Yes, the schools are technically closed, but they're not. There's still special needs students being taught. There's still teachers in the classroom. There's still COVID in the classroom. So that's their question to you. Why aren't those stats being updated?
Yeah, well, we do regular public reporting that captures sort of the day prior's COVID cases within our schools. I will say on the principle, the question related to special education for context, this government decided with the support of the Chief Medical Officer of Health to allow some of the most vulnerable children within our schools, children with intellectual or developmental disability, those that cannot learn remotely online at home. You know, finally, I would argue, for many of those parents who have felt voiceless over many years right across the country, we have made provision to ensure that those kids can get into a school, have access to the therapists and the medical practitioners and other supports that these kids need. They need predictability. They need to have routine restored. And we really felt it was important to build a protocol that keeps the staff safe, absolutely, and we're grateful to every one of them for doing that important work. I know they would care deeply about the kids that they serve with and support. But we wanted to ensure that they had that consistency, and we made that decision based on really the voices from a variety of special education community and advocates and stakeholders that said, look, you've got to make sure that that is allowed. That's what we have done, and obviously schools on a daily basis will continue to provide updates on cases that can take place or outbreaks within school or childcare settings, and that'll continue.
Follow up?
If I could follow up, the teachers are saying that consistency is missing because they're not seeing updates on the school board website. But if I could move to our Chief Medical Officer of Health has said that Barrie is ground zero for the COVID UK variant. How much of a factor will that play in a decision to reopening schools, specifically Barrie proper, or in Simcoe Muskoka, aside from the so-called regular COVID, if you like?
You raise a good point, and that's why we want to make sure we're addressing in a timely fashion the possibility of the role of variants. We're doing a point prevalence study right now. We hope to have some results in the next day of what percent are we seeing in Ontario and on the community basis. The issue in Barrie is a institutional outbreak, unfortunately, and we're taking many steps to try and contain and deal with it. Unfortunately, there's been a number of lives lost as well, as we've seen the impact of how the variant can work in a congregate setting. The question under the Medical Officer of Health, Dr. Gardner, is it out in the community? So we're doing some further testing, trying to ascertain if there's been spread beyond the institution with all the controls and measures in place. So far, we haven't seen that. It doesn't mean we're not going to look for it. And as well, when we want to say we're going to open the schools in that area, in any area, that's why we're asking to have the mild symptoms tested in a timely fashion so we can get the testing done. If it were to be positive, we would then screen that for the 501 variant to ascertain as quickly as possible to inform ourselves whether the variant is actually into our schools or within school-age children. We haven't seen it yet, and we are announcing we continue to do our testing on that. And besides the airport testing, we're going to be doing real-time of any of the positive PCRs, running them through our special PCR we have here in Ontario that we can identify in a very timely fashion rather than wait 2 or 3 weeks for the full genome sequencing to say we do have variants, and then we'll confirm what those ones are. And we'll have some more comments to make about that this afternoon. So again, we'll consult with the local medical officer of health, and we want to see what the situation is with that evolving institutional outbreak, how well it's contained, and is there any evidence of any spread of variants outside that. And we're being appraised of that day by day. And so far it seems to be contained, but we can't conclude that or assume that until we finish our thorough investigation.
Okay. Thank you very much. I appreciate it.